Senator James tells me on a regular basis that the best bills that come before the state legislature are brought by people in our districts that have suggestions for bills. So I was approached by a hearing instrument specialist in my district to pursue this legislation. And this piece of legislation is basically an affordability and an accessibility bill. So what happens is if somebody goes into an office to be fitted for hearing aids, and there's a lot of earwax in the ear, that person has to send that patient to another provider, sometimes at great expense, sometimes with a lot of time, and it ends up being very, very inconvenient for the patient. And not only is the access damaged, but also the affordability, because the charges can be anywhere from $275 to $350 just for somebody to remove earwax from the ear canal. I understand the concerns that are there. I have spoken at length to hearing instrument specialists about the concerns that have been expressed. These are not unprofessional people. They have already gone through training in order to recognize pathologies, in order to ask about medications such as anticoagulants, to assess the risk for bleeding. They carry liability insurance, and if they choose to do cerumen management, they will have to carry additional liability insurance. As a nurse, you learn to do a lot of things that perhaps you did not learn in nursing school, and you can be a competent, knowledgeable practitioner in things that you have additional training for. And so this is one of those, I guess you could call it a scope of practice issue, because with proper training, and there is additional training in this bill to learn how to remove cerumen safely, recognizing pathologies and doing a lot of the things that hearing instrument specialists do are in the basic education that they have, and their licensure covers a lot of things that they do. So I appreciate you all supporting this bill, and I repeat again, it's an affordability, accessibility bill, especially in the rural communities. There aren't a lot of options to send patients when they go to hearing instrument specialists, and sometimes these patients have to travel a great distance just to have somebody remove cerumen from their ear canal. The other issue with hearing aids is that sometimes the hearing aids do not fit properly over time because older individuals tend to produce an increased amount of cerumen. And so here's somebody coming in saying, my hearing aid is not working. The hearing instrument specialist looks in the ear and sees that it's because of a buildup of cerumen. Then they have to send the person away at an expense and time consuming. So hearing instrument specialists do a lot in the ear canal to do the mold for hearing aids and removing cerumen. While it does have some risk, I'm not going to deny that. Just about everything that we do. I remember when my husband was alive and he would be talking to a patient about a surgical procedure and they'd say, "Doc, what's the worst thing that could happen to me?" And he'd say, "You could die." And so there's always a risk of everything that we do within the medical community. But with proper training and with proper caution and knowing your limitations, we can serve patients much better by allowing people who may not have the training to get additional training and then meet the needs of their patients. So would appreciate your support of this bill, and the vote is green. Thank you, Mr. Speaker.